Hello, I'm Ron de Parmesan with your Newscats report. Meow. In a dire situation that threatens the lives of countless children, UNICEF has launched an urgent appeal for nearly $58,800,000 to combat the rapidly escalating Mpox crisis in several African countries. This alarming outbreak mainly affects kids in Burundi, the Democratic Republic of the Congo, Kenya, Rwanda, and Uganda. So far, in 2024, there have been about 22,000 suspected and confirmed cases of Mpox, and shockingly, 60% of these cases are in children under the age of 15. That's over 13,000 children, a staggering figure representing lives at risk and an urgent need for action. Tragically, the crisis has already resulted in over 700 deaths, with approximately 80% occurring among children, especially those in underserved communities. The data underscores just how vulnerable these children are, often lacking access to healthcare, nutrition, and sanitation. The crisis highlights significant gaps in healthcare that must be addressed immediately to protect the most affected. UNICEF is now working to halt the rapid spread of Mpox through enhanced healthcare responses, vaccination efforts, and crucial mental health support for affected children. France Begin, UNICEF's representative in Burundi, has stressed the need for child protection amidst this outbreak, stating, "Educational continuity must be prioritized." As schools prepare to resume, the staggering rates of Mpox infection among school-aged children add even more pressure on authorities to keep them safe. Dr. Paul Ngwakum, the UNICEF Regional Health Advisor for Eastern and Southern Africa, has echoed these concerns, emphasizing the severe health impacts of the outbreak on children. Now, let's talk about a recent twist in this crisis, the emergence of the rising clade 1 variant of Mpox. This new strain complicates the situation, raising serious questions about the effectiveness of existing vaccines. Children in vulnerable populations already face challenges linked to malnutrition and lack of basic sanitation, making them prime targets for this deadly virus. During this critical period, UNICEF is not only facilitating vaccine distribution, but is also ensuring that routine childhood vaccinations continue scrupulously. This integration is vital to mitigate further health complications and shield children from multiple threats. Mark your calendars as I share some key dates. The first confirmed Mpox case in Burundi was reported on July 25th of this year. Fast forward to September 8th, and the number of confirmed cases in Burundi surged past 385, putting a spotlight on the public health crisis the region grapples with and showing how quickly these situations can escalate. Shortly thereafter, on September 16th, UNICEF formally announced its appeal for $58,800,000. Reports also indicate that school-aged children now make up a shocking 33% of Mpox cases in the region, underscoring the urgent need to prevent infections and ensure safe conditions for their return to school. With 3 million children preparing to head back to school in Burundi soon, authorities are readying themselves for potential transmission risks during this pivotal time. UNICEF is collaborating with the Ministry of Education to implement health measures that will help create safe transitions back to in-person learning. This preparation is crucial, as ensuring children can resume their education safely also requires extensive resources. The primary goal is to create a protective environment that nurtures children's health while helping them continue their education, thus moving towards a brighter future. At the heart of this appeal lies the necessity for community engagement and public awareness campaigns. UNICEF emphasizes that tackling the stigma associated with Mpox is just as important as medical interventions. A societal approach is needed for comprehensive health education. This includes combating misinformation and enhancing access to healthcare facilities. By fostering community support and participation, UNICEF aims to ensure that families are educated and empowered to take the necessary steps to keep Mpox at bay. While UNICEF's efforts deserve applause, some still criticize the structural vulnerabilities within healthcare systems that could hinder effective implementation. Concerns are raised about maintaining routine vaccinations while tackling this ongoing health crisis. The emergence of the clade 1 variant adds another layer of complexity, creating doubts about the long-term efficacy of existing vaccines. Critics argue that without substantial improvements in healthcare access and infrastructure, the changes made may not yield sustainable results. Several factors contribute to the resurgence of Mpox in these regions that should not be overlooked. Increased interactions with animals, driven by agricultural practices, elevate the risk of zoonotic transmission. Political instability, particularly corruption in the Democratic Republic of the Congo and the Central African Republic, has weakened infrastructure and hampered healthcare responses, further worsening the crisis. Malnutrition among children exacerbates their vulnerability, leading to a daunting cycle of health issues and poverty. Addressing these root causes is essential for a robust public health response. To add some colour to this catastrophic story, studies have shown that investing in preventive measures and health education can significantly reduce the spread of diseases like Mpox. UNICEF is focusing on grassroots interventions, working with local leaders to empower communities. This bottom-up approach is not only crucial for immediate relief, but also vital in building long-term resilience against such health crises in the future. As we delve deeper into this pressing issue, don't forget to subscribe to our channel for updates on how families like these need our support. Every child deserves a healthy, happy future, and during times like this, our collective support resonates louder than ever. I'm Ron de Parmesan, and this has been another Newscat special report. Thank you for watching, and stay tuned for more updates. Meow!